Hi everybody, this is Ben Sturbo with Dr. Jay Hartley at Hartley Chiropractic and CLEAR Scoliosis Center. Today I'd like to talk about adult degenerative scoliosis. So Dr. Jay, could you introduce that a little bit and explain?
Yeah, so adult degenerative scoliosis is really, it's also used as a term Novo Scoliosis. So the patient doesn't necessarily have scoliosis as a child. So 5% of the population has scoliosis as a child, but 60% of the population has scoliosis as an adult. So we're talking about a segment, usually in the lumbar spine, will have one segment degenerate, and all of a sudden it will tilt like this, okay, and create a scoliosis. So that's a degenerative, or what we call a Novo adult scoliosis, so that they didn't have scoliosis as a kid, but all of a sudden you have a scoliosis as an adult. So the patient will come in almost shocked sometimes because they may have had an x-ray at 60 years old with no scoliosis, and then at 70 years old they have a 30-degree scoliosis. And these scolioses as an adult can cause a lot of pain.
So how is it possible for somebody to just suddenly have scoliosis over the age of 60, for example?
Well, biomechanically, you could have one segment on top of the other, and it could just be a slight tilt, and then all of a sudden there's some degeneration that occurs or some ligament damage, and all of a sudden there's more of a tilt and a slide, and then that gets the whole spine going. So think about it like a previous office that I had. When I went in the back door, there was a leaky gutter, okay? And that gutter would drip when it rained onto the concrete. And if you just looked at that day to day, month to month, you didn't notice anything in the concrete, right? But all of a sudden after 10 years, guess what? There was a pothole, okay?
Right.
So that's the best way to describe this. Subtle misalignments can become large curves, and especially women postmenopausal, they're more susceptible to go through a growth phase in scoliosis. So when you combine that with this tilt, you can get some severe curves. And everybody's seen that person in church or a relative where you'll see them kind of, all of a sudden they're tipping to the side, forward, and then you'll notice that that curve gets really bad, and it can happen very quickly. And those are the people that, you know, I used to be 5'6", but now I'm 5'3". You know, that's a pretty good indicator that something may be going on.
Okay. So what are the symptoms of ADS? Is it something that you can have without even feeling anything?
Well, because the curve a lot of time is in the lumbar spine, in early phases you might not notice any postural shift. But you may start to have hip pain, knee pain. So the patient may be having a lot of hip and knee symptoms, but their orthopedist is telling them that they're not really seeing anything there. So it can be referred pain from the scoliosis. If they're not able to sit for a long time, if they drive and go for a long drive, they start to have back, hip, and leg pain. They can't walk as far as they used to. Those are some of the real common things. Standing at the sink and doing dishes, standing in the kitchen and cooking, especially in the afternoon, they'll start to develop more symptoms.
So how would somebody at home watching this go about screening for scoliosis?
So at home you can use our app that we have on our website at drjhartley.com, and you can look at hip unleveling and shoulder unleveling. You can see if the posture shifted to one side. Many times in adults they'll start to have a forward posture, and those are just really simple screenings. But nothing really replaces an in-office exam and x-ray to really do a specific measurement to see, is this scoliosis? And then as an adult, we're also looking for ligament damage, because we can have these segments out of alignment and we get a lateral listhesis where the bone slides sideways, and that is a common thing, and the only way to really see that is on an x-ray.
So what are the possible treatments for ADS?
So adult scoliosis, adult degenerative scoliosis, we use a similar treatment that we do on younger patients. It's very effective. We go through a process called mix, fix, and set. Mix is a warming up of the spine. So think about a dried up sponge. You find a dried up sponge in the garage and you dunk it into a bucket of water, you wring it out, and it comes back to life. So many patients were able to do a similar type of thing. We call it the mix, or the warming up of the spine. The fix is a very specific adjustment. And then the set is exercises and traction that helps to hold everything in alignment. And then with adult degenerative scoliosis, many times we'll also use something called the ScoliBrace, which when we see lateral listhesis or ligament damage, it helps to hold the misalignment in place and really can change some of these people's lives as far as the pain degenerated from these scolioses.
What are some of the treatment schedules for patients with ADS? Are there different methods and approaches to the amount of frequency that they'll receive treatment?
Sure. So initially, the CLEAR Scoliosis Method, we had two types of care. Your standard care, which is where people come in 3 times a week, usually initially for 4 weeks. And then there's intensive care. It was initially designed for people that would come from other states and countries, and they would come in for 2 weeks, twice a day for 2-hour sessions to try to correct things as close to normal as possible. But what we found is if people have symptoms or neurological problems, they may also choose that option because they're going to get results quicker. So a patient comes to mind that had surgery recommended from their degenerative scoliosis, and they were having foot drop, and within the first few visits their symptoms went away, the leg function came back, and because of the severity of their symptoms and their ligament damage, they chose the intensive care. And so if you're trying to get results quicker, or you have more of a severe problem, then you're more of a candidate for intensive care. The traditional care, standard care, is the 2-hour sessions, but they're spread out 3 times a week for 4 weeks. And so it's more dependent on you doing the exercise at home, and everything's spread out a little bit more. So, but they both get results, but usually the worse the curve, the worse the symptoms, we recommend more of the intensive care.
Okay.
Or if the person's coming from out of town, then they're going to usually be doing the intensive care.
Right. So the person coming from far away and would do the intensive care, would that be just as effective as the normal approach, the 3 times a week?
It's very effective during the first 2 weeks. After that, it's very dependent on them keeping up with their exercises and bracing at home. Right. So we're teaching them how to take care of themselves. So with the bracing and the home exercise, they're able to do that. And on our website, drjhartley.com, there's a great testimonial from a patient, Faye, who had a really good result. She, through her home exercises and bracing, kept up her correction for over a year, and then she forgot her brace and exercise when she changed her location, and her symptoms came back. So it's a great lesson that you can manage this a lot yourself. We teach you how to do it, but you got to keep it up.
Right. What are some goals of ADS treatment?
So the first goal is to reduce symptoms, because most of these patients are coming in with hip pain, knee pain, back pain that's not resolving. They're not able to walk. They're not able to go to church. They can't cook dinner, can't do the dishes. So our first goal is to get them to be able to do those things again. Mm-hmm. The second goal is to stabilize things so the curve isn't getting worse. Small curves become large curves. So we want to make sure this curve is stabilized and it's not getting worse. The third goal is to have a reduction. Surprisingly, even though these patients are sometimes 60, 70, 80 years old, we're able to get a measurable change on the x-rays. The more measurable improvement we can get on the x-ray, the less likely it is going to be to progress in the future. So that's our third goal.
Okay, so for somebody who would come in, get treatment, the most important thing would be to continue keeping up with the exercises to maintain the correction.
Once they're out of pain, they have a reduction on the x-ray, the most important thing is to keep up with their home exercises and if they're using a brace, to keep up with the brace in this prescribed way. Adults don't use a brace as many hours as a child. They may at first wear it often to stabilize the curve, but then they may just be wearing it doing some exercises at home and a couple hours a day to hold the correction.
So after an adult is done with the, I guess, intensive care, or let's say moves to another country maybe and continues their home exercises, is it recommended for them to come back and get a checkup on what they've been doing, maybe another x-ray to see how things are evolving?
So if they're in another country or state, we may have them get an x-ray done somewhere else, or they may come back to our office. But it's very important, especially at the end of the first 90 days, we want to have an x-ray to be able to look at how the correction's holding. Mm-hmm. And then from that information, we may prescribe more care, or we may just tell them, hey, you're doing good with your home exercise and traction. Continue to co-treat with your home chiropractor. And so every case is very individual.
Okay. Is the correction a slow process, or is the spine able to move and adapt very rapidly, or is it something that's, you know, over a long period of time?
So with the intensive care, we're able to get results where we never could before. So what we find is that a little amount of care over a long amount of time, it's very hard to correct the scoliosis. So intensive care, think about it if you just are going to your local chiropractor to get adjusted. You get out of the car, go get adjusted, get back in the car, right? Mm-hmm. So it's very hard to make memory changes in the brain and muscles and ligament changes or soft tissue changes in the ligament, because there's not enough time involved, right? And you're going into your daily habits. So the best case scenario is a patient does intensive care and they're stopping their normal daily activities. So many times the patient from coming from out of town does better in some ways because they stop their daily routine. So they'll go through the 2-hour visit in the morning, they'll get a healthy lunch, maybe lay down, do a few of their home exercises we've given to them, then they come back in the afternoon and do their second 2 hours. And so the body never gets a chance to go back to its normal position. So the one visit literally does build on the next as we're making a correction. The further that next visit is, let's say it's a day or two later, 2 days or 3 days later, you're going about doing all your normal activities, so the patterning that your daily activities have on that spine is going to have more of an influence. When you're doing intensive care, that's kind of negated. Mm-hmm. So you're getting a good correction, going home, getting some rest or the hotel room, coming back, getting a good correction, and we just repeat that day after day. So we're able to make corrections where we never were before because of that.
Okay. Well, thank you very much for watching, everybody. If you'd like to schedule an appointment with Dr. J, you can visit drjhartley.com and subscribe to our YouTube channel, Hartley Chiropractic and Scoliosis Center.